because we have such a crisis situation right now. We have hospitals that are over 50%. We told you the doctors, hospitals statistics. What is your own statistics in your practice?
In our practice, we've delivered over 3,200 patients in the 6-year history of the practice. And our overall cesarean section rate is 4%, and our primary cesarean section rate is 2.5%.
Oh, that's incredible. Our goal is that eventually there's a World Health Organization suggested cesarean rate, which we're nowhere near. We're in the 34.9% in the state of New Jersey. But to get to the 10 to 15%, 10 for low-risk women and 15% for high-risk women is the suggested cesarean rate. And it also correlates with the, 2010, New Jersey 2010 statistics?
Yes.
Obviously, there's something you're doing different. Tell me, I know you explained you work with the midwives, but what is it you physically do with the patient? You know, someone that comes there that they can't get anywhere else.
We basically provide an integrated model. We have physicians and midwives working together. So we feel very strongly that the midwives are really the ones to do the normal deliveries. They provide the emotional support, the physical support. They really have a different outlook and a lot of different skills to bring to the actual labor room to help really guide the women, focus their energy through the labor, and achieve a vaginal delivery in those cases that, you know, sometimes it doesn't go so easily, and you really need that person to help guide and focus. And we find the midwives are a really key part of that. We also try to, and they also see them before the labor, so they can establish that rapport with the patients. And we try to stick very closely to the guidelines that are published by the various organizations, American College of OB/GYN, and other organizations, to stick to the real indications for cesarean sections, the real medical indications.
Okay.
Can you explain, though, the fact that your cesarean rate is so low because your overall cesarean rate is so low because you're doing vaginal birth after cesarean section? Otherwise, you wouldn't stay so low.
Right. Our cesarean section rate, about 85% of, we have an overall VBAC rate of about 86% and a 95% success rate. So a lot of our patients are very motivated to achieve vaginal delivery because they also feel it's a natural thing, and a lot of them just want that. They're not asking for cesarean sections on demand.
They're not.
No.
And that's the Listening to Mothers. There was a survey that was done called Listening to Mothers by Childbirth Connections, which hopefully in a second you can possibly show that website to contact them. But there was just an article to back up what you just stated, that from the New York Times a couple days ago, they had an article about voluntary C-sections result in more baby deaths as well. So not only women are not asking for them, women are not hearing the message that to have them is more dangerous than having a normal vaginal birth.
It can be. You don't want to just have a cesarean section. I mean, sometimes a vaginal delivery there are...
What are some of the complications of a vaginal first-time, not vaginal, of a cesarean, the first-time mom? What are some of the complications? Because a lot of times we just hear, oh, well, it's the second, or if you're having a third or a fourth, you may not want to have a repeat cesarean.
Obviously, the immediate complications after cesarean are infection, bleeding, blood transfusion, longer recovery period of time, blood clots. There are issues with the bonding between mother and baby, and breastfeeding, and definitely issues which everybody else talk about more.
Okay.
Long term, if you get down a path, if you want a larger family and having 2, 3, 4, 5 cesarean sections, there's more risk with the fifth and sixth cesarean, further cesarean sections than with that first one.
Absolutely.
So it really gets you into a corner, into where you can end up with a lot